Hi, my name is Carly and I am going to talk a little more about how we aim to put these recommendations into action. Unfortunately, recommendations stated in a clinical practice guideline can be easier said than done. Even in an ideal world, it can be hard to implement recommendations due to certain barriers like a lack of funding, resources, facilities, or attitudes and beliefs. The Knowledge to Action framework, as shown on this screen, is a tool that aims to bridge the knowledge to action gap. In other words, it helps provide a systematic approach to putting theory into practice. This framework can be used at the research stage, during guideline development, or, like in this case, when putting guidelines into practice. We came to the decision to develop a resource using this framework to help put our 4 chosen recommendations into practice. After reading and assessing the Speech Pathology Australia's laryngectomy guidelines, we realised that we as graduates would not have the capacity to implement all of the recommendations due to a lack of education and experience. This is because becoming competent in laryngectomy is often a postgraduate competency and not covered in depth during the degree. Hence, we identified a problem. This problem is that graduate speech pathologists realistically would not have the skills or knowledge to implement all recommendations outlined in the guideline. And yet, if a laryngectomy patient presented themselves to any healthcare setting, a graduate speech pathologist may be required to provide services to them. We then adapted the knowledge to a local context. Speech Pathology Australia's laryngectomy guidelines are a great go-to resource for any graduate speech pathologist. However, the guideline only states the recommendations. They do not explain how to implement them. For example, the guidelines state that speech pathologists must have a strong knowledge of the anatomical changes. However, it didn't actually explain the anatomical changes. We need to adapt the recommendations and provide the information in a context that was suitable for graduate speech pathologists. Additionally, we had to assess the barriers. One barrier in particular within the laryngectomy population is that graduates believe that they do not need to know the recommendations unless they are working with laryngectomy patients. However, from personal experience, during one of my clinical placements, we had a laryngectomy patient admitted for reasons not associated with his laryngectomy. Despite this, I was still required to care for this patient. I had to educate the staff on how to manage his stoma and voicing, complete a swallowing assessment, and make appropriate fluid and diet modifications. From this experience, I learned that just because I wasn't working within a head and neck cancer setting doesn't mean I won't ever work with a laryngectomy patient. So, at this stage, we knew there was a problem. We knew we had to adapt the knowledge to provide it to the targeted audience, and we knew there were barriers to doing this. Identifying all this allowed us to select, tailor, and implement interventions in a way that would hopefully maximize our outcomes. So, we developed a poster to provide speech pathologists with the knowledge to implement our chosen recommendations. Hence, we are currently sitting at this stage of the Knowledge to Action framework. We aim to provide the resource to all graduate speech pathologists to better prepare them for working in adult inpatient and outpatient settings. The poster acts as an education tool for speech pathologists, particularly graduates, as they have restricted knowledge of laryngectomy for the reasons we identified using the Knowledge to Action framework. The poster explains the anatomical changes associated with a total laryngectomy and their effect on voice, respiration, and swallowing. This provides speech pathologists with the information to appropriately counsel and educate the patient, their family, and the multidisciplinary team. Additionally, the poster contributes to professional development and lifelong learning, which are strong values in the profession of speech pathology. So here is a picture of our poster. You can see it is structured to explain the anatomy before and after the removal of the larynx, and how this affects voice, respiration, and swallowing. We hope that this poster helps graduate speech pathologists understand the anatomical changes to feel confident in counselling patients pre- and post-operatively, educating the multidisciplinary team on best practice patient care, and when generally caring for the patient within inpatient and outpatient settings. Thanks for listening, and Kerry will continue to discuss how the resource can be useful to a graduate speech pathologist.